Cardiovascular disease is a leading cause of death and disability in the world. More people die from cardiovascular diseases than HIV, TB, and malaria combined. Even in Africa, cardiovascular disease has become the main killer, claiming 1.3 million people per year. Once considered ailments of the rich, more and more of Africa's urban poor are silently falling victim to mostly preventable heart diseases, diabetes, and cancers. In 2009, about 2 out of every 10 adults aged 18 years and older in Nairobi's Korogosho slum was either hypertensive or diabetic. Of these, only a fifth had been previously diagnosed, meaning 80% of CVD patients are not aware of their illness. By focusing on both the treatment and prevention, Scale-Up's community-based model aims to be a cost-effective, sustainable, and scalable way to effectively address cardiovascular diseases in urban slums.
We implement a model of care in the slums to protect the population from cardiovascular diseases. And that includes screening, that includes raising awareness, that includes counseling on lifestyle, that includes treatment with medication, and includes as well implementing support groups that follow up with the patients on their medication.
The urban poor are a vulnerable population. Now, dietary practices and lifestyles have become a serious health threat. Most urban diets contain a large amount of starchy cereals such as mandazis, chips, and samosas cooked in fat, salt and sugar, and are low in healthy nutrients. A lack of exercise, high alcohol intake, and smoking puts the urban poor residents at an even greater risk of heart disease. Though 60% of Africa's urban population lives in slums, healthcare structures for treatment of cardiovascular risk factors like hypertension are inexistent. The Scale-Up model works with the community to create awareness on the importance of a healthy lifestyle characterized by largely eating healthy diets, avoiding tobacco use and excessive alcohol consumption, exercising regularly, and avoiding stress. Much of the Scale-Up success is hinged on the Kenya Community Health Strategy. Trained community health workers go from door to door, providing lifestyle counseling and screening community members for risk factors. Those at risk are referred to free health clinics for further diagnosis and treatment.
Nikijaribu kuongea na wamama ama na wazee kuwafundisha kuhusu pressure ama sukari, nikiwa CVD na kujitolea, na tamani sana kupunguza maradhi katika hii area yetu ya Grogon B na kama huku Korokocho, kwa sababu naona watu wasipojijua wanaendelea bado kuugua polepole, lakini wakijijua kuna wale wanajikubali na wale wanajikataa. Na wale wanajikubali kwa kupitia sisi CHW, tunaona tunafanya kazi nzuri na tunakuwa na ile morale.
The Kenya Ministry of Health and the City Council of Nairobi have been a key part of Scale-Up, assisting in the setting up of a clinic where patients can receive healthcare and hosting treatment groups.
We are using our community health workers to educate the public. At least now they are aware of non-communicable diseases and particularly cardiovascular diseases. We are talking about lifestyle changes, behavioral changes in terms of physical activities, reducing the salt intake in the salt intake in food.
In the developing world, cardiovascular conditions actually appear at an earlier age as compared to the developed countries. So we really have to do something on this. The unfortunate thing is that these conditions are not highly prioritized in the region, and because of that we really do not have data. So we are also encouraging countries to capture data in these conditions so that they can be controlled properly.
community-focused efforts to address the cardiovascular health of the urban poor must be at the center of development discussions, especially now as we come to 2015 renewal of the Millennium Development Goals.
Ugonjwa wa pressure nilijua kulingana na vile nilipimwa na Wangari. Wangari alinipima pressure pamoja na sukari. Ndio nilikuja kujua niko na pressure sijui ilikuwa kidogo. Nilipoenda provide nilibaidika sababu nilipewa dawa ya kumeza na nikaendelea naye kumeza, habari nimesikia mzuri. Juu nilikuwa mtumiaji wa pombe, ilibidi niwaache. Na sigara pia bado nikawachana nazo.